Thank you to the organizer for having me today. I'm Meng, psychologist from University of Malaya Medical Center. So we have heard of mental health issues faced by people living with HIV in Jeremy's presentation, and I will be focusing on some of the important factors associated with how people living with HIV from my hospital prefer to be screened for their mental health status. Mental health issues among people living with HIV is not uncommon and they are highly associated with poorer HIV outcome and quality of life. Despite the importance of mental health in Malaysia, like many other countries in Asia Pacific, mental health service is not integrated into the HIV care model. In our ID clinic in UMC, we are planning to integrate mental health service which include screening and linkage to care into the HIV care for our clients. Before we do that, we first ask our patient how they prefer the mental health screening to be. This study took place in ID clinic of UMMC from January 2020 to May this year, recruiting people living with HIV attending our clinic. We conducted a survey asking our client how they prefer to be screened for their mental health status in a clinic. We also collected their demographic, social behavioral characteristics, and any history of mental health issue and treatment received in the past. The participants can either answer the survey in paper format or tablet format. Based on the resources we have in clinic currently and some of the options that we consider are feasible, we listed 6 options for them to rate. And these options are paper-based self-administration, electronic-based self-administration, screening by HIV nurse, psychologist, HIV doctor, or peer support personnel. Descriptive analysis was done to summarize participants' characteristics, history of mental health condition and treatment experience, and the preference in mental health screening. Cut-off point of more than 2 on a Likert scale was used to determine the preference of mental health screening modality. We then used logistic regression to determine what factors are most related to the participant's preference of mental health screening. Significance was maintained at p-value less than 0.05. This slide shows the characteristics of the study's participants. The median age of the participants was 41 years old, with the majority of them being male and slightly more than half of them were Chinese ethnicity. Despite 80% of them being employed, half of them only had income of about $920 every month, which falls into the Malaysian national income bracket of bottom 40% group. And almost 30% of the participants had ever experienced mental health condition in the past, with 20% of them receiving a formal diagnosis. We also asked our participants if they were willing to undergo a short mental health screening during their follow-up, and we found a vast majority of them were willing to do it. Participants were asked to rate their preference, which include paper or electronic-based self-administration, screening by HIV nurse, psychologist, HIV doctor, or peer support personnel. Guess what? The top 3 preferences of mental health screening were electronic-based self-administration and screening by psychologist or HIV doctor. And with the participants' characteristics, history of mental health condition and treatment received shown in previous slide, we then proceed with univariate analysis for all 6 screening preferences, and out of the 6 options of screening assessed, we found these factors are significantly associated with 3 out of 6 screening preferences, which are the electronic-based self-administration and screening by psychologists and peer support personnel. So in the next 3 slides, using multivariate analysis, we will dive into some of the important factors that are related to these 3 screening preferences. So let's talk about participants who prefer to do mental health screening on their own with electronic-based devices. Compared to the older participants, those who were younger were more likely to prefer this option. Also, those who obtained secondary level education or above were more likely to prefer this option compared to those who attended only primary school. However, we did not find that participants with different employment status, income level, or whether they are from the LGBTQ+ community have different opinion on self-administration mental health screening using electronic devices. And mental health screening by psychologists was the second most popular preference for the study participants. We found that those from different ethnicity groups did not have different preference in terms of mental health screening by psychologists. However, compared to participants with primary education level, those who obtained secondary education level or above were more likely to prefer screening by psychologists. Compared to the participants of Chinese ethnicity, those of Indian ethnicity were less likely to prefer mental health screening by peer support personnel. In terms of sexuality, we did not find different preferences in mental health screening by peer support personnel from participants who identify themselves as member of LGBTQ+ community than those who did not. So in summary, most of our clients were willing to undergo mental health screening as part of their routine HIV care in a clinic. During the integration of mental health service in HIV care, we should aim to use screening tools that are self-administrated and can be integrated into electronic devices. However, based on our past experience of using electronic-based data collection tools, some of the issues that we can foresee, such as data security and integration of different databases, needs to be addressed. Although mental health screening by psychologists and doctors were among the top 3 preferences of our client, it can be really challenging, as one of our efforts to task shift is to move this to less specialized health staff such as the nurses. Before we can integrate the mental health screening into our HIV care, we need to better understand why patients choose these screening preferences by doing qualitative study. I would like to acknowledge the contribution of my study participants and my colleagues who contributed to the study and presentation today. Thank you.